We're going to go ahead and get started, but we'll keep an eye on anyone joining virtually. We just have to admit them to the meeting individually, so we'll be doing that throughout. My name is Lauren Denauer. I am with Consumer Health and Food Safety. I am a foodborne illness investigator, and I also do program coordination for the FDA retail program standards. Myself, Amanda Anderson, and Shane Carroll are also going to be presenting. So thank you all for coming. I haven't put it back onto that screen.
Yep, I'm sorry. I was responding to a chat.
Okay. Maybe Amanda, do you want to moderate the chat while Shane is admitting people to, or letting? So we're gonna, this is a two-part presentation. The first part is going to be on foodborne illness prevention, and we're going to talk about some foodborne illness outbreaks that occurred in Pima County. These are the questions we're going to answer. What is foodborne illness? What are the primary symptoms of people with foodborne illness? Causes, the number one cause, as well as effective foodborne illness prevention methods, what to do if you have a sick employee at your restaurant, whose responsibility it is to make sure that sick employees are not working, and what makes an effective foodborne illness policy. Alrighty, so we'll keep an eye on the chat, just in case anybody wants to type a response in there. But for anyone in this room, does anyone want to try answering the question of what foodborne illness is, or what they think foodborne illness is? It's alrighty, so it's kind of a catch-all term. It appears over 300 times in the food code, but there is no definition in the food code. The definition that we have for this presentation is from the CDC. It identifies that foodborne illness is a common, costly, and preventable illness that you can get after having foods that have been contaminated with either germs or toxic substances. And we do have effective ways that you can prevent foodborne illness. Anyone want to take a guess at symptoms of people with foodborne illness? Yeah, excellent. Vomiting and diarrhea, those are the big ones. The other ones we want to mention are jaundice, that'd be yellowing of the eyes or skin, sore throat with fever, and then any lesion on their skin that's containing pus. There's some specific parameters around that one, but we just don't want you working if there's a risk of you contaminating food. So when someone is a food handler and they have any of these symptoms, they're at an increased risk of getting other people sick because they're ill, they're handling food, and that's going to be served to the public. So we want to be really careful because that's a huge issue. The causes of foodborne illness we kind of touched on, but the main thing is that it's from consuming food that's been contaminated by bacteria or the toxins produced by that bacteria, as well as parasites or viruses, chemicals, and other agents. The FDA and the CDC estimate that it causes 3,000 deaths annually, and so that's more than what fire deaths in the US. It's a little bit more than how many people die each year from fires. So it's a huge issue in the US, and we do have one of the safest food supplies in the world, but obviously there's a lot of room for improvement. Another interesting thing is that every year our retail food establishments. More than 1,000 of them there's more than 1,000 outbreaks at retail food establishments every year. So we're going to go into how these outbreaks occur and what you can do to prevent them. So Pima County has had some large-scale foodborne illness outbreaks recently.
So in the chat, there was a question about, are there FBI tests to take, like a COVID test, the COVID rapid test, and respond? There are not any other, counter rapid tests available. Rapid tests.
Excellent. Yeah, and we'll hopefully touch on how we work with the epidemiology team to identify food workers that have gone to the doctor, tested positive for a certain foodborne illness. Obviously, once that happens, our epi team works with these individuals directly, educating them on the fact that they're not allowed to work while they're ill, although there is no, rapid foodborne illness test. So the interesting thing, though, is that it is getting easier to detect and trace with advancements in testing. So we're seeing a lot more outbreaks, whether or not they were occurring before we had these testing methods. We might never know, but now that we have advancements in testing, we're able to intervene and impact public health in a positive way. So we have a couple of outbreaks that we're going to talk about that happened here in Pima County recently. Outbreak A required a lot of site visits from us, multiple bioremediations. They lost several thousands of dollars in profits, and at the end, when it was all said and done, the owner estimates that it cost them about $100,000 during the busiest time of their year. So prior to their closure, 44% of the surfaces in their kitchen were contaminated with this pathogen. And these are everyday food contact surfaces like cutting boards, deli slicers, and virtually every handle in the kitchen that employees touched habitually, like the walk-in refrigerator handle, had this pathogen all over it. It was the same pathogen that made individuals ill. So we worked with this facility on getting this resolved, but it was an enormous amount of surfaces. So close to half of their surfaces had this pathogen on them. And this facility looked extremely clean. They prided themselves on having a good foodborne illness policy. And, it just kind of caught them by surprise. The second outbreak required an immediate emergency response. It immediately affected more than 50 individuals, and we had to work collaboratively with law enforcement, the CDC, Arizona Department of Health Services, and Arizona Public Health Laboratory to get this situation resolved. So these outbreaks are happening here in Pima County, not just somewhere in the U.S. Oh, sorry, I'm gonna go ahead.
Question about outbreak A, was the business completely shut down?
So we did, because of the level of contamination and due to the bioremediation, the business had to close multiple times to address this outbreak. And at the time, we worked with them, and they had a professional remediation service come in, and a few months by, and we ended up finding out from the state laboratory that additional people were ill with the same pathogen. So we had to go back to this facility and readdress the problem. All right. So both outbreaks were preventable by controlling foodborne illness risk factors. You can do that by having a clear employee illness policy at your facility and using active managerial control, that really involves leading by example. So showing your employees that you don't come to work when you're sick and educating them that they don't come to work when they're sick with symptoms of foodborne illness. That way you can establish a good food safety culture around foodborne illness prevention, because at the end of the day, how many facilities have $100,000 to prevent this outbreak from happening? I mean, it costs a lot more on the back end than it does to send one person home. And I'm gonna talk about a third outbreak later on that we had very recently. And because we do want to go over what to do if you have a sick employee who's working while they have foodborne illness symptoms. In the event that you find that that happens, you do need to take some additional measures. So we'll get there. What the number one cause of foodborne illness outbreaks in restaurants is, does anyone want to take a guess? Lack of hand washing is that's a great guess. And it's definitely one of the main interventions we have with preventing the propagation of, so the spread of the germs throughout the facility. But actually workers coming to work sick. And we have known that that is the number one cause of foodborne illness. We've known that for the last 10 years. So it impacts you, it impacts your employees, your customers, and your bottom line. And you can actively prevent this from happening by making sure that your employees know that they cannot work when they're sick with foodborne illness symptoms. So I do want to point out that NORS and NEARS conducted a joint outbreak investigation study, and they found that of the 800 facilities that had outbreak, over 90% of them did have an employee illness policy. So just having a policy doesn't prevent a foodborne illness outbreak. But there are things that you can do to make sure that your policy is clear and that you're enforcing your own policy. So that's what we're going to talk about, the effective foodborne illness prevention methods.
Can you just clarify that anytime you talk about saying it?
Yes. For the purposes of this discussion, I may not say, whenever I say the word sick, I may not say sick with symptoms of foodborne illness, but that's what we're talking about. This is just a foodborne illness discussion. So anytime I talk about a sick employee, we're only concerned about people that have foodborne illness symptoms. So if somebody has allergies, we aren't talking about that kind of thing, or COVID. We're just talking about those foodborne illness symptoms. So effective foodborne illness prevention methods are, besides having a clear employee illness policy and having a person in charge that understands that they can't have ill employees, ill with symptoms of foodborne illness working. They need to be at home. So in addition to that, the CDC has identified 5 broad categories called risk factors. So these are based on studying all of those outbreaks. They found that mainly they fall into these 5 categories: improper holding, inadequate cooking, contaminated equipment, poor personal hygiene, and food from unsafe sources. So we want the person in charge and whoever is the manager on site overseeing aspects of your operations that directly relate to these, because that's how you're going to prevent outbreaks in your facility. So outbreak A had items 1, 3, and 4 out of compliance. So I know that it can be a struggle, especially during the summer, to maintain hot and cold temperatures. But again, it can be really costly for you and your reputation if you continue to operate when you don't have the right hot and cold holding temperatures. Additionally, contaminated equipment and utensils. So their dish machine had, it wasn't dispensing the right concentration of sanitizer. And what that ended up resulting in is they grew a really unique pathogen in their dish machine because it continuously dispensed under the amount that chlorine needs to be to effectively kill pathogens as a sanitizer. So you obviously don't want to go beyond what the levels are safe during sanitizing, but you do want to make sure that you're at the right threshold, depending on the type of sanitizer you use. So the other thing that they had as an issue was poor employee health and hygiene, and hand washing was a big factor in that. So those were the 3 things we saw that contributed to the outbreak in the first facility. For outbreak B, we have improper hot and cold holding temperatures. We also have poor employee health and hygiene, and then we have food from unsafe sources. So you can see that these 2 outbreaks had one thing in common, or 2 things in common. The employee health and hygiene issue, which had to do with how they were handling food, but that's also where the foodborne illness policy falls under. So if you're letting sick employees work, then it would fall under this CDC risk factor here, poor employee health and hygiene. And then it's pretty easy to monitor your temperatures throughout your shift. And so we recommend using active managerial control to make sure that you are keeping the food in a safe temperature zone and preventing ill employees from working. So what should you do if you have a sick employee? And by sick, again, I mean sick with symptoms of foodborne illness. We would say send the employee home, discard the food prepared by the ill employee, cleaning areas of the establishment appropriately. So don't just go through with a bunch of chemicals on your cutting boards that aren't safe to use on cutting boards. And if you have questions, we're here. Also, in the event that you did have someone come and work while they were sick with symptoms of foodborne illness, please reach out and call us so that we can help you with any questions you might have so other employees don't get sick. And so you're able to effectively remove any virus or pathogen that might be in your kitchen as a result of that employee showing up while they were sick. So whose responsibility do we think it is to ensure that ill employees are not working?
Is there any recommended?
It depends. As far as recommended cleaners, it really depends on what your employee is sick with. And because they don't necessarily have to offer up that information, but what they do need to offer is if they were diagnosed with any of those illnesses that require them to notify a person in charge, such as salmonella typhi, norovirus, they would need to tell you. It would also need to tell you what their symptoms are. So depending on if they said, hey, I have been going to the bathroom all last night and I thought I could make it through work, but I can't, you know, that we'd be looking at using a potentially a disinfectant that is effective for norovirus. So with chemicals, the label is the law. So always read the label and make sure that it's appropriate for a food contact surface. And if you do still have questions, definitely reach out because we would be happy to help. We assist with outbreaks all the time in different settings. So we're very familiar with what chemicals are effective depending on the situation. So it's a little bit of a broad question for me to answer right now, but we're here for you if you have questions. Whose responsibility is it to ensure that ill employees are not working? So it's going to be the permit holder, the person in charge, the food employees, and your conditional employees. They need to report So it's everybody's job to report to the person in charge information about their health and activities as they relate to diseases that are transmissible through food. And at the end of this presentation, I have a QR code that you guys can use. It'll take you directly to our Foodborne Illness handouts. And I identified the 3 handouts that you might want to download and implement. You can also, well, we'll go over it, but what makes an effective employee illness policy? Well, we've already touched on it. We want workers to notify their manager when they're sick with symptoms of foodborne illness. We want the policy to list all 5 illness symptoms of foodborne illness. I worked in the food industry for over 10 years before I started at the health department, and I didn't know that you couldn't work when you have diarrhea. And I remember the day that I saw that handout that we have called the SD5 and the Big 6 posted, and I was like, I went around to everybody and I was like, did you know that you can't work when you have diarrhea? And none of us knew. So, and I was in the food industry for a long time. So it's a message that I think regulators know, but it kind of gets lost in translation between the permit holders, people in charge, and then the employees that are actually showing up to work, because nobody wants to be an unreliable employee that has to call out sick. But the idea is that we all have to work together to keep this from happening. And the other thing is we want to restrict or exclude ill or infectious workers, so ill with symptoms of foodborne illness. So there might be something, depending on the symptoms they're experiencing, they might be able to just switch to cleaning the floors, but they wouldn't be able to wash dishes, they wouldn't be able to bus tables, and very rarely are they actually able to cashier because they're going to be getting drinks for people too and scooping ice. So make sure you know, based on the symptoms they're experiencing, whether or not they need to be just prevented from handling food or fully excluded from the establishment. So just in summary, require that employees notify their managers when they're sick with symptoms of foodborne illness. Your policy should list all 5 of those illness symptoms, and then make sure that you're actually taking the appropriate action of restricting or excluding the ill workers. And the handouts that we have for you are cleanup for vomit and fecal accidents, employee reporting agreement. You can have a reporting agreement that says exactly what ours says if you don't like the one that we have. And then we also recommend posting the SD5 and Big 6, because during routine food safety inspections, we ask you, do you know that symptoms of foodborne illness that would require an employee to be restricted or excluded from work? And we might not ask a person in charge, we might ask your employees to gauge their understanding. And if they don't know the answer, this handout isn't posted and they haven't been educated on it. And that falls on the person in charge and the permit holder. One thing I want to say about this is we had a major outbreak where they had a sick worker. They sent that person home and they did not discard the food. As a result, this was over several days because it was a convention, but as a result, all of the workers in the kitchen got sick. Most of the attendants at this convention got sick, and even the manager got sick. So it was really difficult to find people to interview because everybody was sick the 3rd day, all because they didn't discard the food after they sent that person home. So that is a really important follow-up action because it costs that facility their reputation. So this is the QR code. It'll take you directly to our website where the handouts are. You can also just go to Consumer Health and Food Safety, and then on the left-hand side, it'll say Food Safety Handouts. And I'm going to turn it over to Amanda Anderson, who's going to go over the Foodborne Illness Complaints.
Thank you. So we're going to discuss a little bit about what foodborne illness complaints are and when we will investigate them. We know this can be a scary time for your facility. If you see an inspector come in and you say we have a foodborne illness complaint, you don't always know what to expect. And we want to make sure that you know that we're working with you and what the basis of foodborne illness complaints are, what level of serious you need to take different aspects of complaints. And so we'll go over that information right now for how we receive those, what they are, and then also what an investigation might look like for your facility. So anyone can submit a foodborne illness complaint. And recently we have changed our system for accepting complaints. So we used to just take whatever someone wanted to tell us, and then we would go out and do an investigation at our facility. So this would create last meal bias. People a lot of times think whatever they see in the toilet is what is sick. Most times that is not the case. So taking any complaint could also be because people are upset. And so we really want to get rid of that issue with our facilities because we are partnering with our facilities. We are not trying to target our facilities. And so we're not going to help other people target them as well. Because we do struggle with that at times too. If there's been employees that have been let go or people are just upset with their service, sometimes we get those complaints. So we just want to make sure we are really addressing food safety when we talk about foodborne illness complaints. So now they have to complete a full survey on our website. And this is going to include questions like, what did you eat for the past 3 days? Because that can really give us insight on what might have actually got them sick. You know, it probably wasn't that meal you had last night, but 2 days ago, I'm just gonna pick on salad because it's always in the news. Could have been that salad. And so then we start seeing lots of people indicating salad in the last few days. You don't know what got you sick, but now we have 2, 3, 4 people saying the same thing. That's definitely gonna be a red flag. We also receive complaints from our epidemiology program. And so these are going to come from people that have a confirmed foodborne illness. And so we are going to monitor those as well to see where they're from and the food items that they're indicating in their food history. These are going to have a pathogen associated with them though. So they're going to have those illnesses that we identify on the Big 6, Nasty 5. I might have switched those around. So we will get those and we'll monitor those as well for the food history. And if they are an employee that indicates either way from our survey or from epidemiology that they work with food or work with a highly susceptible population, we're going to reach out to that facility, even if there's no indication that it's foodborne related from that facility, because we want to make sure they don't cause a foodborne outbreak within that facility. We also get phone calls and we'll either go through the complaint form with them or ask them to do it on the website. And then we also have complaint forms that come directly from Pima County. Just the general website, most people, this is more of that I just got sick. We do ask them to fill out a more complete form so that we can see what their full food history was. So we're not going to investigate those, just I got sick. It was definitely this restaurant because they looked at me funny or whatever the case may be. We're going to investigate when we have 2 or more people from different households that indicate the same restaurant. It doesn't mean they have to have the same food at that restaurant because we know food workers can touch different food or there could be cross-contamination for other reasons in a restaurant, but we need to have at least 2 different individuals from different households indicate that they were sick, including epi complaints that come from epidemiology with confirmed illnesses. Because just because they think it was somewhere, there's no way to 100% know it was what they think they ate at that restaurant. So we also have outbreak responses, and Lauren talked about outbreaks a little bit too. So this is when we have multiple people indicating the same facility, we have a pathogen. Usually sometimes it's unknown, but we still have a lot of people going to the doctor and seeking medical care. So you do have to seek medical care for us to see if it's an outbreak because we're going to have a confirmed pathogen, and then we're going to have to go look for that pathogen in the establishment. So in both, we're going to need 2 or more people from different households to be sick. Foodborne illness complaints don't have those confirmed diagnosis. Your outbreak is going to have a confirmed diagnosis of a reportable disease from a lab test. If it's not reportable, our epidemiology is not going to know about it because labs are not required to tell us about them. And Arizona has a whole list of reportable illnesses.
We just have a comment. So you were looking for patterns rather than isolated events?
That is correct. We're looking for patterns instead of isolated events, because isolated events, you could be getting sick from anywhere. It could be your dog, it could be, you know, the cart at the grocery store and then you touched your mouth. So we're really looking for patterns of people saying, I got sick from this place. And then getting back to the unknown GI outbreaks, sometimes we start hearing, especially with the schools, you know, children pass things on very quickly. So we have unknown GI outbreaks, but we definitely know it's a GI outbreak going on because of the amount of people that are getting sick at those schools. Yeah, go ahead.
How do we address related to this having allergic reactions? Can you give some solutions?
Right, so allergic reactions, we're not gonna address at this time.
I like them, maybe allergic to gluten. This survey, if they are.
Right, and so that's why we are looking at needing multiple people to get sick instead of just that one person. And that kind of gets rid of that bias there of, right, you had an allergy, you don't know you have an allergy, and so it's bothering you. Have we heard that other people are also getting sick? So yeah, at this time, we're not addressing allergies, and if we move to that point, we'll definitely get that information out to everyone on how to control for allergens and the cross-contamination in your facility. So we'll definitely work with you guys and get you educated when we do get to that point and have it in food code. So here's some information about the difference between a foodborne illness investigation and an environmental assessment. So most of it's going to be the same because either way, we're looking for contributing factors. Those are going to be the biggest ones. So those are your improper holding temperatures, your improper cooking temperatures, dirty and or contaminated utensils. The big one that Lauren just talked about is the poor employee health and hygiene. So there's going to be a detailed look at your employee health and hygiene. Your illness policies will be come out for either a foodborne illness investigation or an environmental assessment. So the big takeaway here for the environmental assessment, and so this is going to be the one associated with an outbreak, is we're really going to be looking closely at your sanitation products and protocol. Lauren touched on this a little bit. Not every sanitation product is going to be effective, especially if you're not using it properly. And I'm going to go back to talking about schools because they end up with vomit and fecal matter all over the bathrooms. They can get everywhere. If you're not cleaning that effectively and sanitizing it with the correct product at the correct concentration, you're not going to be able to stop that outbreak. So with an environmental assessment, we're going to work really closely with you, look at what you have, recommend if you need to get something else from your supplier, and make sure your school is using them properly. A lot of people, I mean, we have the clean and dirty pens now. I don't know, you see them everywhere, but are they doing anything? What are they even cleaning them with? If they're not sanitizing them, it really doesn't even matter. And then we also have more outbreak control measures. So we're going to look at exactly what's going on through the facility, look at the food flows through the facility, look at the people flows through the facility and see if there's a point where we can hopefully stop the outbreak. At times we will sample if we need to try to determine where in that facility the pathogen might be hiding. This can be very challenging, as Lauren discussed in her outbreaks. We have data in literature that says where pathogens are most likely to be, but pathogens are also changing all the time. And since we are having stronger and better cleaning methods, they're also responding and they're going different places. So we need to really think about that as we're just in our facilities and our regular cleaning and sanitizing. You need to address everything so we can really find where these pathogens are hiding to prevent an outbreak. And then in both of these, a routine inspection may be conducted too. Just want to make sure food flow and everything is working the way it needs to. We get representative temperatures from your hot holding, cold holding, cooking, anything you might be doing in the facility. And especially when we're in an environmental assessment, we're really coming to partner because we want to stop any further illnesses that might result from either your facility, or what we really also need to remember here is a lot of times food items come in already contaminated. So we have our fresh produce that comes in, and you guys see these recalls and these outbreaks in the news all the time. You get something in that's already contaminated. That's why you really should watch your cross contamination and hand washing in your facilities so that you don't spread it any further. Because not everything gets cooked, so not everything has that kill step. So we're really coming along beside you guys because we know that sometimes it's coming from the farm. And so we just got to do our part at the retail level where it's going to be fed to the consumer to make sure we're stopping it as much as possible. Any questions?
So there's a question on Teams. It says, so you are looking for patterns rather than isolated events.
We already did that. Yes.
Oh, we did.
We're looking for patterns.
Okay.
Yeah. And you'll see from all of this that it's pattern. So work with your inspector when they're in your facility. If they find one item, they should be working with you, whatever that violation on the one item may be, just get that corrected. We're gonna really look to make sure your whole facility is following some sort of procedure. We know that sometimes one thing gets missed.
What would be examples of other types of outbreaks?
There's a lot of examples. So if we're talking about retail facilities in particular, we're gonna have a lot of salmonella outbreaks, a lot of hepatitis A outbreaks. All the hepatitis A outbreaks you see in the news come from sick food workers. You guys might remember the Chipotle outbreaks that we had recently. Most importantly, 1993 was the Jack in the Box incident where 4 children died from E. coli 0157. So that was serious and that changed laws and how hamburger is cooked, how it's even prepared in the slaughtering facility. So real people died from these. There's been salmonella outbreaks where you can have a perfectly healthy 18-year-old and now they're going to be on dialysis for the rest of their life because it attacked their kidneys. So this is really serious at the end. So you need to do what you can do, follow the cooking temperatures, clean and sanitize as effectively as possible. And if you have an health food worker, you need to get them out of your facility. Any questions? All right, well, thank you, everyone. Email us questions if you have them.
You and your staff, if you extra questions or you needed some time with some from our team, it's really good to get the staff the training that they need. Again, that is upon you as an operator owner to ensure they follow procedures, but if you wanted to have some additional time or working on some procedures with our team, we can set some time up if you reach out to our team. Definitely here to be a resource when we are there for those investigations. We're not trying to hinder any part of your process, but really just come to finding what the bigger concern is. I realize there's a lot of turnover in establishments and it's hard to continuously train, but if you get some effective standard operating procedures in place, that's really helpful to utilize for any incoming person. Always reach out to us as a resource. If you have questions or need help to explain something to your team members. Sometimes they may not see it from the perspective of someone else that's gotten sick. Right? They're just there doing their job, but what's important about their job? That's what we want to try to get. We appreciate everyone's time. Anyone that is on the chat, if you wanted to identify what establishment you might be associated with, that would be nice. Or you can email us separately to let us know. And I will turn it back over to Amanda.
Okay, so that's it. Thank you. Thank you guys for coming. And thanks for everyone online for joining us today.